For those who are living through the COVID-19 pandemic, they're going to be emotional scars. And for those who've survived and who didn't contract the virus, there's also a lot of focus on the physical well-being of patients right now. But of course, we know that there is a psychological impact that living through this period also has. Professor Ashraf Kagee is a psychologist and co-director of the Flisher Centre for Public Mental Health. He joins me now. Professor Kagee, good evening, and it's such a pleasure to have you on the Pulse tonight. Many people are living through all sorts of emotions. It moves from anxiety, stress, but people are also having to deal with so much grief and not being able to mourn in a way that they would have before. From a psychological impact, I wonder, how do you interpret everything that's happening, and can it be defined as trauma?
This is a very important issue that you're raising. I think it's important to keep in mind that the trauma or post-traumatic stress, as we refer to it, is a disorder of memory. So a very traumatic or tragic event occurs, like a disaster or an attack. And then when people are reminded of the event, they experience enormous distress. They have physical reactions. They have upsetting memories of the event. They have flashbacks and nightmares, etc. We don't have enough data about people's experiences of trauma, long-term data, to know what the long-term effects are. But by all accounts, it is a very distressing experience. I think there's a great deal of anxiety associated with fear of getting ill, fear of having to go to the hospital, fear of being on a ventilator, and fear of dying. So that is certainly what we know about it. What we don't know at this point are the long-term effects.
Let's talk about the moment that people are living through. Earlier I spoke about, the number of deaths that are taking place and the fact that families can't go and bury their loved ones. Friends can't go and say their final goodbyes. What process does that do in a general mourning period, that now that we're unable to do that, what are some of the side effects in which it can manifest itself in people's lives?
Yes, absolutely. These are very, very important things. We cannot visit people. We cannot visit the elderly. We can't visit people in hospitals, enter care homes, attend funerals in the way that we used to. And human beings are social beings. We need to connect with other people. And if that cannot happen, there is a great deal of distress associated with this. Grief, bereavement, loneliness. That many, many people experience. And I think especially for elder members of communities where they see people who are their peers who are getting sick and who may be dying, and their own fear of becoming ill themselves, this is enormously upsetting and distressing. One of the things that we should also keep in mind is the social media and the role of technology in creating other kinds of communities, WhatsApp groups, for example, or Facebook groups, where people can connect with each other and provide support to each other, provide social support and some kind of family support even. I think we should harness these kinds of ways of helping each other through this difficult period.
Social media, of course, can play a big role in creating virtual communities. At the same time, this influx of information, of changing information day to day, can also leave one in a very overwhelmed state. How does one know when they're being psychologically affected by the information that they're consuming, by their surroundings and their circumstance? At which point can an individual actually say, I think I'm not the way that I was before this?
Yeah, I think this is a really important point. There is such a thing as information overload, and too much information can create a great deal of anxiety. I know a lot of people are addicted to the news. They can't get away from the news, and this is problematic. I think when people start experiencing a great deal of distress, anxiety, depressed mood, when they are unable to function, when they're unable to get out of bed, for example, because of depression, or have suicidal thoughts. These are warning signs. These are signs that something is not quite right. And there are ways of accessing support for these kinds of conditions. For example, the South African Depression and Anxiety Group provides a huge amount of resources available, as well as support to individuals and families. Also in the Western Cape, for example, we have something called Lifeline, which is a telephonic counseling service that a lot of people have access to, and it's free. And so I would encourage folks who are experiencing psychological difficulties, extreme anxiety, distress, depression, even people who are finding themselves dependent on substances like alcohol, to seek support from these sources.
Is it dangerous when people start to feel lonely and feel very isolated, also because of some of the measures that we're having to implement as a result of COVID-19, or is it natural for people to be feeling that way?
Well, it's quite natural for people to be feeling this way in the context of the pandemic. This kind of not happened before, really, in our lifetime. And so it's a very new experience. It's a different experience. I think where the danger is where people are unable to function, unable to cope, unable to parent, unable to do their daily activities in the way that they usually do. And also when people start having feelings and thoughts of wanting to end their lives and doing harm to themselves, this can be very dangerous. And this is when support definitely needs to be sought.
Professor Kagee, let me thank you so much for your time on the Pulse tonight. And it certainly is important for us to also be reflecting and taking care of our mental well-being as we continue to fight this global pandemic.